And joining us via Zoom this morning, we have Dr. Colleen Wood. She's a pediatric endocrinologist with Billings Clinic, and you're here today to talk about some of the tough decisions that parents are making since we're so close to the start of school. So what concerns are you hearing from parents of children you treat that have chronic illness?
Yeah, thank you. I see primarily type 1 diabetics and endocrinologic disease, but I work at the pediatric subspecialty department at Billings Clinic, and we see kids with chronic disease of all types coming through our hallways. And I think right now the biggest question that parents have is it safe to send my kids back to school? This is something that I think is weighing on parents quite a lot, and there's no easy answer. I haven't met a single parent that has made a decision who feels really strongly that they made a great decision and that it's the best thing for their kids, because there's so many things to weigh. The social aspects of school are really important. Getting that in-person learning is super important. But with the COVID-19 pandemic, a lot of parents are really worried about the health of their children and their families.
And so tell us, what are some of the considerations that parents should take into account when deciding whether to do in-person learning or some of the virtual learning?
Sure. I think that, when you're thinking about your child's health and your family's health, it's a family unit. And definitely school is an area of exposure. And so you're hoping that your school is able to provide you with the three pillars of safety, which is masking, good hand hygiene, and social distancing. And if your school can do that really well, then I think that you're mitigating the risk as much as possible, and hopefully your kids will be safe to go to school. If your school is unable to do those three pillars really well, then you may need to consider other factors like the susceptibility of your particular child to the disease and how seriously your child might get the disease. We know that conditions like asthma and diabetes are high risk conditions and may make the disease course a little bit worse.
All right, Dr. Wood, thank you so much for joining us this morning. We really appreciate it, and wishing everyone a happy and safe back to school. You have a good day. Thank you.
Thank you.
Thanks. We'll be right back after the break.